Healthcare in Kenya is bending on a 5-month-long strike. Health Cabinet Secretary Cleopa Mailu's appeal to the nurses has been met with defiance from the Kenya National Union of Nurses. The union says will go on with the strike for as long as the national and the county governments do not recognize their collective bargaining agreement. There have been several negotiations with the Council of Governors, but the Nurses Union CBA is yet to be signed 138 days since the strike began. Patients who rely on public health facilities in the country continue to suffer. Well, in studio, I have Dr. Samuel Mwenda, the Secretary General of the Christian Health Association of Kenya. Many thanks for joining us on KTN News Desk this afternoon. Let's perhaps begin with your mandate. What is your mandate as a Christian Health Association of Kenya?
Thank you for inviting me. The Christian Health Association of Kenya was established way back in 1946 by the Protestant churches who are doing health work. We have health facilities across the country, hospitals, health centers, dispensaries, community-based healthcare programs, and also medical training colleges. So we are part of the faith-based health network in this country who provide a wide range of essential services, collaborating with the public sector.
All right, so thousands of Kenyans, of course, rely on public health facilities for their healthcare. It is really the backbone of healthcare here in the country. Many, in the wake of this 138-day strike, have been looking for options and opinions, with private hospitals being a bit too much for them to bear in terms of cost. What alternatives does the Christian Health Association offer?
The health sector in Kenya, in terms of service delivery, has three main players. We have the public sector, we have the faith-based, Protestant, Catholics, Muslims, Hindus. We have the private sector. We also have some non-governmental organizations providing some services. So generally about 50% of the services are actually provided by the non-state actors. So we all collaborate in providing services. Indeed, the non-state actors, for them to provide services, they have to find ways of financing them, either getting subsidies from other sources, from donors, from other stakeholders, but largely from the contribution that service users pay through the user fee. So when there is a slowdown or functioning of the public sector, what tends to happen is that you have increased workload. More of the patients have to find services in the institutions that are operating, and faith-based across the country, because they are established to provide services to the needy, to the vulnerable. They are much more accessible. They are driven by compassion, by love, for care. We get many more people coming for services here, and we cannot turn them away.
All right, let's discuss that in terms of the burden that the nurses' strike has caused on faith-based health institutions in the country. Especially, like you say, you cannot turn some of them away, and not all services are free, so to speak, in these organizations.
Absolutely. Services do have a cost. Even though it may be subsidized, it's still a cost. And people have to meet that cost in order to access the services. However, a time like now, when the public sector is not working, those that have emergency conditions, needing emergency services, they are never turned away, whether they have money or not. So institutions are providing a lot of services for people who have absolutely nothing to pay, and that burden is left in the health facilities. There's a lot of need for increasing the volume of commodities, medicines, and other essential commodities that are needed for providing services. Our theaters are very busy now with operations. So that's part of the shift in the burden and the challenges that come. We also do have a referral system, which works optimally when both the public and the non-public sector is working. So the referral, the next level, is not now optimally available. So there are those that cannot easily access in terms of distance, in terms of cost, to get that next level of service. So our appeal and our wish is that the challenges get resolved, we get the public sector optimally operating, so that we can adequately, serve the needs of the people
of the Kenyans. And speaking then of the challenges that nurses in the public sector are facing, they have remained adamant, very defiant. They will not go back to work until a return to work formula capturing the contents of the CBA has been drafted. Heading an association such as this, the Christian Health Association, you must be privy to some of the needs that the nurses have fronted in their CBA. Just yesterday, Health Cabinet Secretary Cleopa Mailu said some of these issues that they have fronted are not sufficient to warrant a 138-day strike. Where do faith-based associations stand on this issue?
Well, as faith-based associations, we've not been directly involved in the matters of the labor conflict between the nurse in the public sector and the union. But looking as professionals in the health sector, I want to believe that they have genuine issues that they are raising. They are in terms of improving their welfare, conditions of service, but also remuneration. We all want better pay, improved terms of service. But from where we serve from, the foundation of our institutions is based on a Christian calling. So we know we can never compensate people enough. There's never enough pay. But we are driven by, that's responding to that call to offer ourselves to serve. So our appeal is that the negotiations should be concluded so that there's amicable conclusion of the conflict, so that we can have the nurses resuming work and being motivated. Because it's one thing getting to work, but it's another thing when you are happy, you are motivated, so that you give your best.
All right. And of course, being, leading a faith-based organization such as this, many have fronted the same issue that it is a vocational call. It is a job where compassion really should take center stage. Many asking the nurses to go back to work in the wake of the many Kenyans who are suffering. So far, we've seen cases of malaria really shoot up in several parts of the country. How, in your assessment, would you categorize this nurses' strike and its overall impact on the healthcare system in the country?
Well, 108 days are many to have, a sector not properly operational. So the impact has been very significant because nurses really are the backbone of services in all levels of our health sector.
Right.
There are institutions that are completely not working. There are those that are working at a very suboptimal level. There are services that have high volumes of patients, children requiring immunization, mothers requiring deliveries, and that they cannot easily access in the facility closer to where they are. So there has been an impact, a big impact for people who can't easily access services where they are. But I really want to appreciate the faith-based and the private sector for being there, standing that gap. And we know we have health workers who have worked under very constraining circumstances, having to bear with a very, very heavy workload, but they have kept on for the sake of desperate, very sick Kenyans who need services and help.
Right.
So our prayer is that all efforts between the government, the county level, at the national level, and the union and the health workers themselves should be fast-tracked so that we can have this matter resolved and we have all our workers back in their stations.
Right. And of course, many Kenyans have been looking for alternatives. Many, however, not privy or not aware of the services and alternatives that faith-based organizations offer. Of course, issues of cost would be the first concern to those who depend mostly on public hospitals. So in terms of the cost subsidies, in terms of those who cannot meet the cost altogether but still have to come to these faith-based organizations, how do you go about this?
On the contrary, the cost is not that too much of a barrier across or they're faith-based. You'll be surprised there are services that are completely subsidized. Today, we are also providing free delivery services.
Right.
We've joined the government-supported free delivery services program, which is called Linda Mama, that is now administered through NHIF. So mothers are able to go to any faith-based hospital or health center that is providing those services, and they receive them for free. We have HIV services that we provide across the country, which are free, completely free, because they are subsidized by commodities coming from government and a lot of donors, Global Fund, PEPFAR, that are funding this. The other services, the fee may be there, but many times it's also very highly subsidized. So, and unlike the very sophisticated, complicated special services that may have a little more fee, the others are quite modest. In fact, many times they are quite comparable, even with what public sector charges. In addition, I want to indicate the contribution NHIF is making. For the faith-based service providers, when you have an NHIF card, the services are actually free. Both outpatient, there's an outpatient package, but even admission, inpatient services, they are fully covered by NHIF, including surgeries. So we also want to encourage our people to ensure that they have NHIF cards coverage, because with this they can access faith-based services without needing to have money
to do the same. Yeah. All right. Perhaps your final comments, even as this nurses strike continues, the Council of Governors, the Ministry of Health, the Kenya National Union of Nurses, really each pointing fingers at the other. There seems to be no end or no solution in sight. Your final comments in this situation?
Well, my appeal is that we must have a solution because our ultimate wish is to have our services across the country fully and optimally operational. So we really appeal to our leaders, county governments, the nurses union, the government at the national level, Minister of Health, and all the other stakeholders to work towards a definitive solution. As we would continue working on this, our other appeal is that any support that can be extended to the faith-based facilities across the country who are bearing this load, whether it's essential medicines that we can extend to the communities that are coming for services, finances or other resources that are essential for health. We are appealing that support also be extended to the faith-based who are out there providing service, as well as some of the private sector who are out in communities bearing this need.
Absolutely. Thank you so much, Samuel Mwenda. He is the Secretary General of the Christian Health Association of Kenya, an association that oversees a faith-based organization offering alternative healthcare in the country in the wake of the nurses' strike that has crippled the public health system in the country. This is